They are afraid of making mistakes because they think all the dentists who show beautiful things that they don't make the mistakes. Everyone makes mistakes.
Meet Dr. Xander Rijpstra, co-owner of Peak Functional and Aesthetic Dentistry, specializes in complex rehabilitations and implant treatments, and also known for his patient-focused approach and passion for modern dentistry. Dr. Xander combines contemporary dental techniques with a commitment to creating confident, healthy smiles.
You do wonderful direct composite injection technique, which can be controversial to some of the prosthodontists.
You can use your healthy teeth and you can rebuild it, or you can make it aesthetically looking better, even when you don't have to grind something away and you don't have to harm your healthy teeth.
What was the main concept you were aiming for when you first started your clinic?
I always say my colleague dentists in the future have to be as good as the dentistry I'm doing. I think you have to share all your knowledge or your experience you have with the people who are working with you.
So what was the most defining moment in your career?
The most defining moment in my life was that I find it a little bit bored after I was a little bit bored after 5 years.
I love that answer. That's the honest answer.
Yeah.
What do you think is the biggest problem now with social media? With only good work is being shown and patients get a lot of misconception. What worries you?
I think
A very good morning, everyone. And we're back and we have Dr. Xander today with us, all the way from Netherlands. Welcome back to Kuala Lumpur, Malaysia. And thank you for doing this podcast with us. And I know you're still jet lagged, but didn't have much of a sleep. But thank you for doing this.
It's an honor to be here and to do this podcast with you. So thank you for the invitation.
Thank you.
I'm glad to be here.
Well, for those who may not know you, can you just describe a little bit about yourself?
Yes, of course.
2 minutes.
Yeah. I'm Xander Rijpstra and I'm 41 years old. And I'm coming from the Netherlands. And we have a private practice in Deventer, a city near to Amsterdam. It's about 100 kilometers.
Mm-hmm.
I graduated in 2007 in the city of Groningen.
Oh.
Groningen. And I studied dentistry for 5 years.
Mm-hmm.
In the beginning, we started with 6 chairs in Deventer, and we became bigger and bigger in time. And now we have a specialized clinic in restorative dentistry, implant dentistry, with 18 chairs, 60 people who are working with us. And we deliver all kind of specialties, treatments within the dentistry and what people need for a good practice. And we believe that quality is above the quantity of the work we are doing. Mm-hmm. So quality is the most important thing. And it's we think that it's important to give the best dentistry we can give to our patients.
Yeah, I think everybody must understand now why I brought Dr. Xander onto our dental podcast. Firstly, it's a big achievement at 41 to be having such a big troop and big group. And what's most impressive when I first met you was the fact that you believe in quality, given that it is in an environment that is not as easy. And some of us in Asia might think that we are not allowed, our charges in dentistry may be very low, but in Netherlands, I think you would like to share, despite the charges being fixed at a certain pricing, and you have done so well and still believe in quality and do the kind of beautiful work that you do. Yeah. How do you actually achieve that and find the balance?
I always say that dentistry, it feels for me like a hobby. So I always go to my work with pleasure. And I think that's the most important thing. And if you make good quality work and you can be proud of it, then you will last longer and you have a happy life.
Yes.
And of course, we want to earn money in the end. And I won't say we don't earn money in the Netherlands because we do. But I think in the end it could be better. but it's all steered by the government, and we have maximum tariffs we could use. So that's the issue we are dealing with. Yeah.
So it's very hard to actually differentiate quality if there is already a maximum cap pricing.
Yeah.
How do you tell your patients that is different, and how do you deal with it? And I know you're so famous. You're one of the best dentists and well-known dentists in the whole of Netherlands. And everybody knows your name, your practice, and they know that you provide the best care. And that's why patients who that have complications and difficult cases, they all come to you. But how do they know you seek quality, despite the fact that everyone appears to be the same? Yeah.
This is a good question, and it's hard to show people that you are for better quality than other dentists.
Yes.
And I think it's not easy to show them, and they can't make a proper decision by themselves because they don't know what dentistry is in the end. They only can see the aesthetic, the end result you make. And I think it's a good thing to show your patient what you've done in the past. And the referrals of my own patients, we show them on the internet. We show them in our own private practice. So people can see what other people were going through and what the end result was, and that they are very satisfied and happy with their teeth. Yeah.
No, that's amazing, because we all have this issue and we feel that everybody is the same, but it is not. And it's all, I think the most important thing is you yourself. You actually believe that you can do quality care despite and irregardless of how much it's being charged. You still stand by the fact that you treasure quality and what the decision is right for the patient. Yeah. So one of the things that was very, very interesting with your career that I saw, you went from just doing very general stuff and then went on to do more and more complex things. And then you went on to specialize as well and did more and study more about pros. What was the main drive that did that for you?
I always give the advice to our younger dentists who work also in our private practice, is that they don't have to go too fast. And first you have to know the biology of your patient, that you can properly treat caries lesions with channel fillings and so on, to be in your practical work a better dentist. Because when we are graduated, I always say that you can't do anything at all on the practical side. And you have to make a lot of kilometers in your practice.
Still got a long way to go.
It takes a long way to go. And after 5 years, I realized that this wasn't the way I wanted to go in my life. I didn't want to treat only my patients for the simple things, and I wanted to be the director of the rehabilitations for my patients. And I see a lot of patients that needs rehabilitations. Only in my own practice, there are a lot of people who need rehabilitations. And in our country and in the rest of the world, there are a lot of people who need it also. But our colleague dentists don't see that they need those treatments.
Why do you think that? Why do you think that's what we've been doing with Dental Optimist podcast? It's also, we're just trying to draw out that there is a lot of positivity in dentistry, and sometimes people don't see it. And exactly what you say, why do you think it's hard for dentists to see it? Well, some do and some don't.
But it's very hard to see the bigger picture and to put in place all the pieces you need for the complete puzzle. And that's why it worked for me as a prosthodontist, that I learned how to place those pieces in the right position. And if you you say, or you have some kind of Eureka. Well, now I see what I have to do. And that makes life so much easier. So I recommend it for all the younger dentists, go for a prosthodontist career and be the director of the treatments you want to do for your patients and be a better dentist. And that's what my time passing was, that first I was a dentist, then the prosthodontist. And after some couple of years, I saw that I needed a lot of implants with my restorative plans. And then I decided to become also an implantologist. And have the complete package for dealing with complex cases.
Do you think dentistry has changed, especially over the last 5 years, in terms of restorative dentistry, especially the work that we do now, and how everybody's talking about full mouth rehab and implants, all on folds, all on axis? And do you think that has changed how we look at patients and how we treat patients?
Yeah, it's a quite a bit of a change, mostly because of the digitalization. Digitization.
It has changed because of digitization, and it's more because of restorative dentistry why it has changed.
Yeah, and it gives us a lot of opportunities to make better quality work for our patients because of the computers and the AI movements that we see, that we can treat our patients much better that way. And also the planning of our implant dentistry or with the CBCTs, it can be much more predictable what we are going to do. And I think it's a very good thing that we have in mind the end result, and we make a backwards planning now to become to that end result in a proper way. Yeah, you're right. We could not see as much 5 years ago, even with digitization. No. But with the softwares that we have now, it's easier for us. Once we have a report or what's been planned, we can make the decisions as dentists what to do and what not to do as well. Yeah, and I think it's a great step forward we are making now. Yeah, and I think in the future that only will be better. Yeah, I hope so for the younger ones as well. Yeah. How do you ensure the team works properly in your clinic? What was the main concept you were aiming for when you first started your clinic? I always say my colleague dentists in the future have to be as good as the dentistry I'm doing. And I think it's good that in the end, me and my colleague is also specialized in restorative dentistry and implantology, that we are not needed in the end for our private practice, and that another dentist with us can take all the work over from us. And I think that's a good thing. You have to share all your knowledge, all your experience you have with the people who are working with you. And that's why I think it's a good thing, and I like it to be here to show also your dentists to what we are doing. And backwards, they can also show me things where I can learn from. And we have to learn from each other. Yeah, that's true. I always believe in learning through the numbers, as in the more patients you see and study together, the faster you learn. And the less patients you see, sometimes it takes a bit longer for you to learn. And when we all come together, we all benefit. And absolutely,
that's the power of numbers, actually.
And I think a good thing in a private practice is that you have more specialities than one, and we have to work together. I can't do everything by my own, by myself, and it's good that we have now a special division for orthodontic treatments, and I know a little bit of orthodontics. I know where I want to place my teeth, but the rest of the planning has to be done by an orthodontic. And not by me, because I don't know how it works. And I have not so plenty of time to... we can't do it all. I can't do anything, not at all, no. We all wish we can do it all, but it's impossible. It's impossible to do it all. You are one of the most well-known restorative and aesthetic dentists in Netherlands. So what was the most defining moment in your career journey that you believe affected your training path, and that's how you ended up choosing pros?
Was there one particular moment that you decided, I just want to be the director of what goes on? Or you just enjoy doing it?
No, just what I said. I the most defining moment in my life was that I find it a little bit bored after some. I was a little bit bored after 5 years.
I love that answer. That's the honest answer.
Yeah, you're working for 5 years in our private practice, and I missed the challenges in dentistry to become a better dentist. And that's why I chose this path to become a prosthodontist.
Yeah, and I think you got bored by every day just filling the gap, filling the fillings, restoring. And I think
just go to your work, go to bed, go to work, go to bed. Yeah, that doesn't feel right. Yeah.
Actually, dentistry is so much more than that. We see so much more. It's a lot of fun if you start seeing dentistry from a full perspective. But if you see it from a job perspective of every day filling a gap and every day doing the same thing again and again, I think that's not the challenge. The challenge for us is, how do we solve the case? How do we treatment plan? How do we get this patient back? And how do we convince the patient? I think those are the things that you do extremely well, being so humble. You're not saying it, but...
And you make your life as a dentist also much easier. Because you know how you can treat your patient, and you know to do it in a right, proper way. And in the end, you see end results you make which last for 10, 20 years. And that's the goal you have to proceed.
Yes. And that's the one that when you see them 15, 20 years down the track, that is so interesting.
Yeah. Then you can give yourself
a pat on the back.
Yeah, exactly.
Okay. If you can give one or two scenarios where it's most beneficial for full mouth reconstruction, because a lot of dentists are still stuck in the filler hole. They don't see the full picture. They feel that the patient comes in, they just want the presenting complaint to be treated. Can you give us an example? How do you actually walk through and make the patient understand that actually you don't just need this, you actually need a full analysis and an assessment? How do you identify this wear and tear full mouth reconstruction cases?
Yeah. If I have a patient with some problems in their mouth because they miss a teeth, or I see some wear problems in their mouth, then I always ask to myself, is this a patient who needs more treatment than only replacing a teeth by an implant? Because it's when we place one implant, we can't go backwards, and we have to make a decision if we go to the left or we go to the right. And that's always what I'm explaining to my patients. And most of the patients then say, I want to go for a treatment plan and to see what's possible. And in the end, it's always the wish of the patient, what I'm going to do, but I can inform them. That's the most important thing, because they don't know everything. But when they have got the good information from us as prosthodontists, then they can make a right decision of what they want and what they want not to do. And I think that's the big advantage of give them a good, proper plan. But I treat them with a plan when I see that there are more things in the mouth which are not correctly done by functional biology and so on. If it's one filling, it's okay. But if there are more problems, most of the time we make a proper plan for our patient.
Yeah, that's amazing. I think what we're trying to get to nowadays with dentistry is it's no longer single tooth dentistry. It's actually a full mouth examination and check. And from perio perspective, we have to check the gums. And then from the pros perspective, you actually need to start looking at the teeth, whether there's wear and tear. And then very often people don't realize that with implants, they are so quick in placing the implants. We're having a lot of problems with that, which is why we've gone down the journey of occlusion. And I think that journey of occlusion is how I got to meet you together with from Idris. Why do you think occlusion is so mythical? To do it in CR, to not do it in CR, to restore or not restore? Why do you think that is still debatable in this current day? And
It's debatable because we see a lot of patients who have a big shift in centric relation and in comparison with the mid MIP.
Yeah.
And in 90%, 95%, it goes well for those patients. So why do you want to treat those patients when there are no problems?
Yeah.
But I think when we have the issue of a clean canvas and we have to make a new plan for our patient, then we have to go back to the basics. And then I think it's a good idea to work from Centric and build up in Centric our rehabilitation. And then you can make proper restorations, which can't fracture anymore, which are protected due to our canine protection and frontal occlusion and this occlusion.
Yeah, I think that's a very good concept, because what happens, there are groups in the world that some just say, I don't even bother. And some says, I always have to be done this way. And I think your defining line is when you have the opportunity, or when there is a chance and it needs a full mouth reconstruction, is we try to bring it back to CR, centric relation, as much as possible, because that's your opportunity to reset. Yeah. And I think that reset button is dependent on the condition and the patient's wishes when to reset. And I think we can't emphasize enough of that, especially as a surgeon. We do a lot of implants and we see a lot of full mouth reconstruction. Very often we don't reset the patient, and it's just as easy as it is, where, to get it back into MIP because some remaining teeth are in that position. And I think it's no longer possible nowadays with digital technology. We should be looking into how can we reset this bite for patients.
And I think it's more of importance when you use total rehabilitation with implants, then there is no forgiveness of your materials you are using. And then it's even more important to work from the point of CR.
Yes. How you mentioned that 95% of them that are restored mean there might be a big shift and they're okay. And do you see them going downhill? Does it always go downhill? Does it cause more wear and tear and breakages or problems down the line? Do you think that happens or?
No, definitely not. There are a lot of cases where there is a big shift and there are really no problems. But you have to be aware that when there are problems, that you see the bigger picture and that you take into account that there could be a big shift in CR to centric, from centric relation to maximum intercuspation. And I think that all our colleagues has to be aware of that possibility, and they have to see it in the end. And it went well in 95%, but that 5% we have to see them.
Yes, you're right. That's what dentistry is all about, right? We have to see the 5%, and we can't just see the 95% and ignore the 5%. I like that one.
Okay.
All right. How would you like to encourage the young ones, despite the fact that you have fixed ceiling in pricing, all right, in Netherlands? And I think that's a very admirable thing and a very respectful thing of what you're doing with your practice and your team, because a lot of people can't do what you do, given that, that's it. I can't be bothered. I just want to do volume. How would you encourage the young one? Or what would you say actually drives, or how do you talk to your younger dentists?
Keep in mind your goals you want to achieve in your life. And I think you have to work for a long time in your life, for probably 30 to 40 years. And you have to make your life much more fun when you know what you are doing. And that's why I emphasize quality above quantity. And go to a lot of courses, learn a lot, invest in it, and you will earn the money later on. And in the beginning, you have to learn your business and what you are doing, and your dentistry you have to learn. And after 10 to 20 years, you can have your own private practice, and you can earn your money. And
No, I think we all say that, but I think it's hard sometimes for them to understand until you go through it. And,
But it was always our goal,
Mhm.
and I think it worked for us. So probably it works also for our other colleagues.
Yes.
Hopefully.
Yes.
And I'm a happy dentist.
That's good. Okay, coming back to materials and techniques. You do wonderful direct composite injection technique, which can be controversial to some of the prosthodontists, and they always believe in full mouth rehab. You should go to the final restorations. You should not use direct composite injection technique. What made you do such beautiful work? And of course, this has shifted now. Now it's coming back in trend again.
Mm-hmm.
What do you think changed?
The big advantage, I think, for composite injection mold technique is that you can copy your digital planning.
Mm-hmm.
That's very important. That you can keep your plan
as close as possible.
Close as possible.
Mm-hmm.
Yes, that's what I meant. And I think another big advantage is for the composite restorations is that you don't have to grind away any healthy material.
Mm-hmm.
You can use your healthy teeth,
Mm-hmm.
and you can rebuild it,
Mm-hmm.
or you can make it aesthetically looking better.
Mm-hmm.
Even when you don't have to grind something away and you don't have to harm your healthy teeth.
Yeah.
And I think that's the biggest advantage of injection mold techniques.
Yeah, I've seen how, it's so conservative that we can just bond on top of it. You don't lose any more unnecessary tooth structure unless you really have to round off some edges and things like that.
Yeah.
But it's beautiful. Is there any downside other than the fact that we know that composites may not last for as long?
Yeah, that could be a downside. But the advantage is also that you can repair it very easily. And after a couple of times, probably 5 or 10 years, you can redo it in the end, because the injection technique isn't as expensive as the porcelain restorations. So you can use it as an inter-transitional period. And later on, you can also redo it and change it in porcelain restorations if you want to. But then you can do it in a later on stage when your patient is a little bit older and the risks are not as big as they are 20 years old.
Yeah, that's true.
Yeah,
that's true. No.
So it's only advantages, I think.
That's true.
The only disadvantage could be the how it fits well on your teeth and how you can clean your surfaces and your interproximal spaces of the teeth you have treated.
Yeah, I think it's the subgingival part. You do beautiful work. I've seen your slides and your teaching and how you teach. I think what I was trying to get through the message was to do such high quality work, you actually need a lot of practice, and you need somebody good like you to be able to share all the tips and tricks, because a lot of people just inject and it's overflow everywhere and they don't care, and it's a mess for us as periodontists, And
I totally agree with you. Yeah. Also, you have to learn how you do it, and you have to make you have to make yourself better in using these techniques. But that's with every technique we use in dentistry.
Yeah, I think in the very end, it's still the finesse and the quality that we're looking for, as you said. Yeah.
And some dentists never learn it, but our dentists become better dentists in time. Yes.
We all make mistakes, and I think our purpose is to encourage and let people know that we all make mistakes.
And show your mistakes with each other. I think that's also with the multimedia we see nowadays.
Only beautiful stuff.
We only see beautiful work, but you have to show also the work that didn't went well and how you resolved it in the end. Because that are the cases where younger dentists can learn from. Yeah.
I don't think that's coming out, because a lot of it's all coming to social media. That's a good one. We might just divert there first. What do you think is the biggest problem now with social media, with the way how only good work is being shown and patients get a lot of misconception? What worries you?
I think that most dentists who see only the beautiful work, they think they are not as good as they should be. And I think that could be a problem for our dentists.
The younger ones.
For the younger ones, and that they are afraid of making mistakes because they think all the dentists who show beautiful things that they don't make the mistakes. And that's why I emphasize to show just those mistakes to encourage our colleagues to be a better dentist in the end, and that everyone makes mistakes in their daily work.
No, that's
but in
amazing.
the end, you have to know how to resolve it.
Yeah. No, that's beautiful. I think that's one of the most important message, of so many podcasts that we have done, because we all tend to think that it's perfection, but in actual fact, we know we've gone through crazy stuff in order to get to where we are. And the younger ones sometimes don't see it. They immediately think that it has to go there.
Yeah.
And I think this current world of social media sometimes puts unnecessary stress on the young ones that are learning and coming up and not given a chance to actually perform. Yeah. I love that one. I think we should do one session just showing our mistakes. That should be
I've just shown a lot of mistakes this morning, and I think they've learned a lot of the cases I've treated. So it was a pleasure to show them those cases. Yes.
Yeah. And it's not many people that are as good as you where they're willing to share. Most people don't and don't want to tell the honest answer. And
try to be humble. I think that's also very important.
Yes. Yeah. That's true. All right. When it comes to the field of restorative dentistry, because materials have changed so much, CAD/CAM, all kinds of stuff, there is a big debate now between zirconium and no
lithium.
Zirconium. Yeah. Lithium Disilicate only. What are your thoughts?
I use only lithium restorations. I've banned zirconia, only zirconia for my bridge work.
What kind of bridge work? On teeth or on implants?
Implants, teeth, but the big advantage of lithium disilicate is that the hardness of the material is not so hard as zirconia. So the destroying capacities of your crown and bridge work isn't as big as zirconia. And if you use the proper way to attach your crown and bridge work on your natural tooth, then it won't come off. And there are examples of crown and bridge work which I've placed with lithium disilicate, and it went wrong. Didn't place it well. Then I had to grind it off, and then you see that it's a lot of work to grind it off because I sticked it so good to the element. And I don't see the advantage of using zirconia above the lithium instead of the bridge work because it's stronger. Otherwise my lithium would break. And if you keep in mind the right function and the right protection of your molars and your occlusion, then you will be fine with a material just like lithium.
How do you do the opposing if, let's say, one side is zirconium and one side is lithium? Or you just use the framework of zirconium and then have lithium? Yeah,
then I will let the framework is of zirconia and the porcelain will be baked on top of the zirconia bridge.
Okay.
But we have equal materials to each other. And,
even in full arch implant cases as well, like full arch as in all on axis and
no, in the full arches with implantology, then I choose the material of total zirconium because then the risk will be too big because it's the material won't move.
Yes.
And then you have still a problem when it's baked with porcelain, then it breaks off. And then the advantage of fully zirconia is I think a better solution, a better option.
What do you do with the opposing jaw of this? Let's say it still has the remaining teeth.
if you have remaining teeth and you use implants
On the opposing jaw.
jaw. That's a good question.
Sorry, I'm pushing you to the corner.
I think in those cases, I would prefer the different materials. Then I would go for fully zirconia in the
On
upper
the top,
jaw.
yeah.
When we have implants in the upper jaw, and for the lower jaw, the lithium.
Yeah. Yeah.
But lithium is, for me, it's the
It's the gold
preferable,
center for teeth.
Yeah.
Yeah, for teeth.
And due to the gluing capacities, and nowadays I use not a flowable for sticking my veneers, but I use a normal composite, which is being heated, and my veneers are being heated, and then you can have a very smooth surface of the outline surface of your crown to your natural element.
So that's all smooth.
Yeah, and in time you don't see any discoloration
or margins
on the margins, and I think that's also a very big advantage of using a normal composite instead of a flowable or a normal cement.
Okay. That's a good trick, and we have to watch you do this and run the courses here.
I would inform them and we will show them.
Yeah, that's right. We will have to do the courses. Yeah. All right. That's a good question. What happens when it's full arch? One more question. Full arch, implants to implants, and then do you do full both arches? Zirconium to zirconium?
Yeah.
You would do zirconium
fully
to
monolithic. Yeah.
Yeah.
No doubt.
Yeah.
No doubt.
Thank you. Because that was a conversation that we were having a big debate with our technician for some time.
Yeah.
Yeah. Because the full arches is very hard. I totally believe in lithium disilicate for the teeth. Yeah. But when we are talking about implants, it's another world.
It's totally different.
It's another world. It's so hard to deal with. And I think, to me, I don't think we have found the perfect material yet.
No, and we have the clinical experience that when we've used the combination of zirconia with porcelain, we see that it went wrong.
Yes.
And we want to avoid that the patient is coming back to your office.
Yes.
We have to repair it, and you can't repair it. So you have to take it all off.
Yeah.
Have to replace it. It's a lot of work.
Yeah.
And you have to avoid it.
Yeah. I know. I've seen my patients 15 years on zirconium framework with porcelain on top, and the porcelain wears down completely over time, and the opposing teeth is now being worn off by the zirconium framework underneath. And that's like, oh my God, that's when you start thinking, what have we done?
And it's still functioning. Most of the people are still satisfied, but if you take a look in those mouths, you want to replace it. And,
yes, that's right. Yeah, and I think that's why full mouth reconstruction is so complex. It's all about muscle activity and so many things we need to talk about as well. Yeah,
and that's why it's so important, even in these cases, that we need to into account the centric relation.
Yes. And I don't think people emphasize that enough. And secondly, most of us attend courses, and a lot of us attend courses just to learn the technique, which you have started, like yesterday you were running a course of composite injection for us. I noticed that most of the dentists in there were just trying to learn the technique. They were not interested in why we need to use this technique or how we should use this technique or when we should use this technique. And I think that's the diagnosis part which is missing.
That's the most important thing. Yes. Everyone can learn the injection technique. That's not so hard.
It's like everyone can learn to place the implant. But it's not the implant itself. I
always give that example also.
That's one is hard. Is there anything that you can say to encourage the young ones or encourage most of us? How do we look at things from a different perspective and start thinking backwards, and start looking at diagnosis first, looking at things from a different way instead of just focusing on learning the technique? Because very often, as you run education in Netherlands, we run education here with Ancora, we find that people only want to sign up for courses if there's a technique. If there's no technique and it's something else that the course gets dragged a bit longer, they're not interested. Why do you think we have this mindset?
I think dentists are people who want to do something. They have a different mind in treating a patient, and they want to get the burr instead of making a plan for their patients. But I think in the end, we as dentists have a problem if we have such a focused way of doing our dentistry tooth by tooth. And it's a better thing to see the bigger picture.
Yeah.
And makes life as a dentist much easier for us all.
Yeah.
And for the patient.
Which is why we're developing the report for everyone.
Yes.
Hopefully that's going to help people as well to be able to see better.
We don't have to hope. It will help.
It will.
It will
Oh, thank you. Thank you. Thank you, Dr. Xander. All right. Smile transformation. Let's go back to the patients now. I know that a lot of our patients do listen to this podcast. And of course, some part of it, when we discuss dentistry, they don't quite understand. There is this big shift in smile transformation. Aesthetics are big on social media. How can patients know which is good, which is bad? What do they look out for? What do you think
in
they
my
should look at?
opinion, it's very hard that they can make their decision on their own. It's very hard. I see a lot of patients in the Netherlands who go for dentistry in Turkey. And they can go for total rehabilitation over there for a lot of less money than they pay in the Netherlands.
Oh no! Yeah.
And they all think on social media that it's the best dentistry they can get. And if I see them in my chair, I have to cry. And it's totally ruined their healthy teeth. And they have for the moment a beautiful smile. But in 5 years, it's done.
Yep.
And they need prosthetic
Rehabilitation. Yeah.
Because of the problems they interfered in another country due to another dentist. And I don't think they can make the decision on their own. They have to be well informed, and they have to be well informed in what we can do as good dentists and why we are better dentists than the average dentist.
Yeah. And I think that's the hardest, and which is why we've decided to come out and speak as well and bring all of you who are so good to speak out, because very often you are too busy working and nobody's going to show why you do better work and you just live within your circle. But actually, I think it's the same problem everywhere around the world. And
you can interview your patients and say what they found of their treatment, but that's still hard to bring over the right message.
Yes,
because if the dental work isn't done properly, you still have people who find it very well done and they are very happy with what they have at that moment.
Yes.
So it's hard to
I
solve that problem.
I equate it like fixing a car. It's actually very complex. You can do patchwork, but eventually at one point the engine needs to be overhauled. And to overhaul the engine is not easy, and it takes time. And it needs good planning, it needs good knowledge, it needs good experience, and there's no quick way.
Slow dentistry is the best dentistry there is. So people have to wait. And I can't do it in 1 week, but there are dentists who can. But I take the time, and I plan it for half year to a year. With orthodontics, it's sometimes 2 to 3 years.
Yes.
But I know the end result is stable, and I have a happy patient.
Yeah, I think the stability as well as long-term result is what we're looking for. And I'm so glad you brought this out, because there's no way we can do dentistry in a week, and especially for smile transformation or full rehab.
You can.
It's not fair to even do that on patients. That's why. Good. There's one more thing that you would hope for the young dentist to take away. Is there anything that you would impart to the young dentist that you would like to talk about?
Of this interview? I think it's the most important thing for the younger dentists that they keep in mind that they have a goal in their dental career. That they have to learn in the beginning the normal way of dentistry. be more practical in what you are doing in the beginning, and afterwards you can search for your specialties and search for what you will want to do in the future. And then you can go further in your dental career and do the courses you need in your pathway you want to walk. And I think that's very, very important. And quality still stays above quantity.
I think that's a very tough message, but it's the right message. I think looking into the future, especially now with digitization, we see things so much clearer. There is no way we can just live in the old world and ignore things that goes on. Yeah.
Yeah, definitely.
Yeah. Okay. Before we end, for the future, is there anything that you wish we can do in our industry that can help? Or what do you think are the innovative products that are coming out or you wish that we have?
I wish that we can further go into our treatment plans from the beginning to the end. Mm-hmm. And I hope that for all the dentists in the world who we work with, that they all have the access to the treatment plans, know how to treat people, and do it in a proper way.
Yeah.
And I think that's hopefully for the future the right way we can
influence
influence other dentists.
Yeah. I think that's where the report that we're working on has to come in, and hopefully it can help people stay a certain path, and if they want to, and if the patients also understand what's going on in their mouth. I think that's what we're hoping for.
Yeah, and you have to take into account indeed the wishes of the patient, the wishes of the dentist, and don't do things you are not comfortable with. And if you are not comfortable with, and it's better for the patient that it's been treated right, then send the patient to your colleague who can treat the patient as well. And don't hold it for yourself.
Yes, I think that's a very good message. Despite the fact that you're double trained and you still say that things that you don't do, it's best to get it to the right person to treat. And
we have all our limitations.
Yes. And there's no way we can practice solo nowadays. You know, a lot of people still think that we can, but you can't actually. Yeah. Thank you for coming on.
Thank you so much.
For you, very, very small gift.
Thank you.
This is for you. So Dental Optimist came about because we wanted to make everyone a little bit more joyful. And this it's Danish actually. All right. In the 1960s, the designer came out with this and said that at that time, this is not a toy, but it is to make you happy.
Thank you so much.
This is the color of your flag. Your national flag color. The orange.
The orange one. It's the color of the Netherlands. Thank you so much.
No, you're welcome.
For this interview.
Yeah, thank you again, and thank
pleasure.
you. Yeah, thank you for doing this. We're gonna have to do more for all the reports and everything else, but I think this is the first stage of what we're doing.
I would like to do it for you and all the other dentists.
Yeah, thank you.
Yeah.
Thank you.